Acetyl Max. Detailed instructions for use. Acetyl Max is a medication containing the active ingredient acetylcysteine, used to thin mucus in the respiratory tract. Acetyl Max. Acetyl Max is a medication containing the active ingredient acetylcysteine, used to thin mucus in the respiratory tract. Mechanism of action. Acetylcysteine is an antioxidant and a cysteine analog. It works by breaking disulfide bonds in mucus, reducing its viscosity and making it easier to remove from the respiratory tract. Pharmacokinetics. Absorption. Acetyl Max is rapidly absorbed through the gastrointestinal tract, reaching peak plasma concentrations approximately 0.51 hour after administering a 200,600 mg dose. Pharmacokinetics. Bioavailability. Oral bioavailability of the drug is low, possibly due to intestinal metabolism and first-pass metabolism in the liver. Distribution. Acetyl Max is widely distributed throughout the body. Pharmacokinetics. Elimination. The drug is primarily eliminated through the urine, with renal clearance accounting for approximately 30% of the total body clearance. Indications. Acetyl Max is indicated for use in the following cases. Mucus thinning and cystic fibrosis. Acetyl Max helps to thin the thick mucus in the lungs, improving respiratory function and reducing the risk of infection. Respiratory disorders with viscous mucus. The drug is used to treat conditions such as indications: acute bronchitis, chronic bronchitis, pneumonia, sinusitis, otitis media, acute bronchitis. Indications: chronic bronchitis, pneumonia, sinusitis, otitis media. Routine cleaning during tracheotomy. Acetyl Max helps to clear the respiratory tract and remove mucus in case of tracheotomy. Acute bronchitis. Indications: chronic bronchitis, pneumonia, sinusitis, otitis media. Contraindications. Acetyl Max is contraindicated in the following cases. Children under 2 years old due to insufficient data on the safety and effectiveness of the drug in this population. History of asthma due to the risk of bronchospasm with all forms of medications containing acetylcysteine. Contraindications: hypersensitivity to acetylcysteine. Patients with a history of allergies to acetylcysteine or other components of the drug. Precautions: close monitoring of patients at risk of developing asthma. If using acetylcysteine for individuals with a history of allergies, close monitoring is necessary to detect early signs of asthma such as shortness of breath, wheezing, or chest tightness. Precautions: use of bronchodilator inhalers such as salbutamol if the patient has bronchospasm. Bronchodilator inhalers such as salbutamol should be used before using Acetyl Max. Pregnancy and breastfeeding. Consult with a doctor before using Acetyl Max during pregnancy and breastfeeding. Drug interactions. Acetyl Max can interact with several other medications, including antibiotics, anti-inflammatory drugs, bronchodilators, antibiotics, anti-inflammatory drugs. Drug interactions. Bronchodilators. Inform your doctor of all medications currently being used before using Acetyl Max. Antibiotics, anti-inflammatory drugs, bronchodilators. Side effects: common nausea, vomiting, abdominal pain, diarrhea, indigestion, rash, itching. Uncommon nasal congestion, cough, headache, dizziness. Rare serious allergic reactions such as anaphylaxis. Notes: always follow your doctor's instructions regarding dosage and how to use the medication. Do not increase the dosage or stop using the medication without your doctor's consent. Store the medication in a dry, cool place, away from direct sunlight. Keep out of reach of children. Notes: if you have any questions or experience any side effects, contact your doctor or pharmacist immediately. Additional information: Acetyl Max can be used in combination with other medications to treat respiratory disorders. Your doctor will adjust the dosage and duration of treatment based on your specific condition. Disclaimer: the above information is for reference only. For detailed information, please consult with your doctor or pharmacist.